Most of us here may not realize that we take a breath of fresh air every 5 seconds that passes by. For those with healthy lungs, breathing is so spontaneous, we hardly even think of it. But for millions of people out there that suffer from respiratory illness, breathing can be a real struggle. Many common conditions like obesity can result in respiratory symptoms. These symptoms worsen when these patients lie down, and that affects their sleep quality. Turns out, the treatment that doctors prescribe is strictly based on the severity of the symptoms presented. So, to measure these symptoms, doctors use a very old technique known as spirometry. During the spirometry test, the patient is trained to take a deep breath and blow out as fast and as hard as possible into the spirometer, and the volume exhaled indicates lung function. Now, the problem with this technique is that it has very little to do with how we normally breathe. So it sometimes gives false negative results, even in patients with respiratory problems. In fact, spirometry is typically normal in those with obesity, yet these individuals exhibit respiratory symptoms like wheezing and shortness of breath. So in the first part of my thesis, I helped develop a better technique that could change the way doctors measure respiratory symptoms. The device that we developed is shown here. It's known as TremoFlow. It measures breathing mechanics. And by breathing mechanics, I mean how easy or how difficult it is to move air into and out of the lungs. The device performs these measurements by sending small puffs of air into the lungs while the patient breathes normally on it. It's a very simple, easy, and convenient test, unlike spirometry. Now, in the next part of my thesis, I studied the effect of weight loss on breathing mechanics. So I used a device to measure breathing mechanics in those with severe obesity. Then I compared the results to spirometry. I studied my obese subjects before they had weight loss surgery. Then I repeated my measurements at 5 weeks and at 6 months after their surgery. Our technique demonstrated and revealed for the first time that these obese individuals initially had some difficulty moving air into and out of their lungs. But their breathing mechanics significantly improved with weight loss. And this also led to some improvement in their sleep quality. These results confirm that our technique is more sensitive to breathing difficulty. Therefore, it is a better tool for managing patients with respiratory symptoms. Thank you for listening.